And moving on here on Sports Medicine Weekly, Doc wanted to get into a little bit about scarring. Okay, people have surgery. You're trying to improve the way we close wounds, right? And we're going to talk with a gentleman who may have that answer, right?
Yeah, it's so interesting, Steve. When we think about surgery, right, or going through a surgical procedure, there's so many different perspectives on what that means. And as a doctor, we don't often think a lot about closing a wound or necessarily the scar that we're going to leave behind. We're thinking about how do we fix the problem on the inside? How do we make sure that the tendon's going to heal or that we restore stability to the knee or whatever we may be trying to achieve with the procedure? But when we flip it around and think about it from the patient side, I'll tell you one of the most common questions I get in the office is how big's the scar and what it's going to look like.
Yeah.
And when you talk to patients, and you probably have friends that have had surgery and talk to you about their experiences, that's one of the things they tell you, right, is look at this scar. It looks beautiful. I mean, he did such a great job. I mean, to them, that equates with quality and how the surgeon performs. So it's probably something that we need to think more about as surgeons. Unfortunately, we've got technology that's evolving with products like the one we're going to talk about today, BandGrip, which makes it easier to close wounds, makes it faster to close wounds so we can do things more efficiently in an operating room setting. It helps us to save on cost, which is obviously a big concern in 2019. But most importantly, we think that it's actually going to improve wound healing, decrease the risk of infection, and improve cosmesis for patients.
All righty. BandGrip owner and founder, the CEO, is Fred Smith. And Fred joins us right now on Sports Medicine Weekly. Again, the BandGrip Micro-Anchor Skin Closures. Faster, easier, non-invasive way to safely close wounds. And Fred, thanks so much for joining us here on this Saturday morning on The Score with our Sports Medicine Weekly show. So you got to tell us, carrying on from what Dr. Nick was telling us, what is BandGrip, and can you explain how it works?
Sure. And first, thank you. It's great to be on your show. BandGrip is the next generation that will become standard of care across the nation and the world. If you go back just as a general history, I'll sort of give you a narrative, then we'll tell you where it is. Back in the Egypt days, that's when mummies were actually using the first sutures. And they really didn't change much since then. So it's been hundreds of years using that technology. In the 50s to the 70s, the stapler became a next innovation. And then the most current one, sort of super glue at the end of the 90s. So while there might be robots doing brilliant things and minimal invasive surgery at all these hospitals, Rush has been great in receiving the idea of, a scar lasts a lifetime. Is there a better way to approach it? So what we did is, in the last 10, 20 years, there's nanotechnology, microtechnology, and we looked at the nicotine patch, which is just a simple patch with microneedles. And they don't hurt. They just grab the skin. And it was meant to deploy medicine. And we took that technology, but we curved the micro needle into a micro-anchor, and then we put it on a stretchy piece of adhesive. And what it does is it pinches the skin closed, like you were walking around with your two fingers pinching it. So it's a non-invasive. There's no metal in it. There's no suture in it. And it just pinches the wound closed. So it's the next generation of skin closure. And as the doctor was saying, there's lots of great side benefits. The main one is the patient, when they come in and you're taking out the staple or you're taking out the suture, they have great fear of pain at that moment. This has no pain when you apply it or when you take it off, and it has better scarring or less scarring. And we tell people, a scar lasts a lifetime. Ask for BandGrip. So it's the next generation of standard of care.
Yeah, we're visiting with Fred Smith from BandGrip. He is the founder and CEO. It is a micro-anchor skin closure.
So, Fred, obviously as a surgeon, we think about closing wounds in a surgical perspective, and you gave a great overview about how that's evolved. We still, prior to BandGrip, had favored sutures, which cause problems with, if you use absorbable sutures, we see patients that have actually inflammatory reactions as the suture gets absorbed. And if you use non-absorbable sutures, they've got to be removed in an office setting, which can be sometimes uncomfortable. But there's a whole nother area of wound closure out there that exists in the ER and training rooms. You think about a pediatric population, for those of us who have had kids go to the ER and have to have stitches put in. It's a very traumatic experience for a child to get numbed up. They have to be held down in many cases. Talk about how this can be used outside the operating room in the way we manage wounds.
You and I both, I have a daughter. When she was, 5 or 6, she had trauma, just drama, in regards to a doctor with a needle to give her Novocaine to do the sutures. So the notion that you would not have to administer to a child a shot to numb the area, this is something that is non-invasive, not painful, easy to do. A doctor could do it, or the nurse could do it in the ER room faster. And then there's, in the ER area, sometimes there's patients at different facilities you might not want to come back. So the patient can take this bandage off or this dressing off in 7 or 10 days afterwards at home. And it's easy to remove, and it's painless.
Fred,
so it's another generation. And let's go to in training, or let's even go to the military. In a military situation, they would like to have a chest seal that holds. Adhesive doesn't hold in that condition. We've created a chest seal with micro-anchors that would grip onto them for wound stabilization. Or the Chicago Fire Department is looking at one of our products that is a 6-inch by 36-inch that's like a tourniquet wrap for wound stabilization even before they get to the ER department, because we would all know, the military or the ER, the issue in trauma is blood loss. And the sooner that you can stop the bleeding and stabilize the patient, the survival rate is dramatically different. I think in the Special Forces, they call that the golden hour. And within 1 hour, they need to have the person in a procedure and stabilized.
Fred, how about at home? Is this something that maybe could replace a Band-Aid that Steve,
That's what I was thinking about, yeah.
Steve could just put on if he's got a cut or his son has a cut?
It is. So, but we're not launching the consumer product initially. What it's going to be is we wanted the doctor's endorsement, and that we're doing procedures like a total knee replacement, or those are complex, difficult things to do. If we're good enough to do a total knee replacement, that means it would be good enough for a mother or a father at home in a year or 3 years. When we launch the consumer product, there won't be a need to go to the ER department. We had a registered nurse who had a 22-year-old cut his hand on a bottle. They were 75 miles away from any, primary care or urgent care. They put one on, within 4 or 5 minutes. The bleeding stopped immediately. He was out in the backyard roasting marshmallows in 2.5 days. It healed. He took it off, and it had a great cosmetic outcome. So that notion of 65 million people that go into, punctures, lacerations, or cuts, those people that someday won't have to go to the ER department. The ER department doesn't want them there. They want to be able to not be, blogged up with lacerations. They want to be dealing with heart attacks or far more critical types of things.
Right.
All righty, Fred. Great stuff. Your website is bandgrip.com. I can't wait till you put it on the market for us consumers out there. But thanks so much for joining us here on Sports Medicine Weekly, making the surgeon's job a little easier right now, right?
Absolutely.
Fred Smith, founder and CEO of BandGrip. Interesting product I love. We got to take a break right now, Doc, so we're going to come back. Steve Kashul, Dr. Nick Verma subbing this week for Dr. Brian Cole. When we return, it's our Ask the Doctor segment, only on Sports Medicine Weekly here on 670 The Score.